Hello, I'm Donal McCauley from BJGP. Today I'm talking to Dr. Tom Round, who is a GP in Tower Hamlets and a researcher in King's College London. His particular interest is in cancer.
Okay, so I've been interested in cancer diagnosis for general practice and GPs for a number of years, and that really started as a GP registrar. One of my first cases was a patient who presented with back pain, which turned out to be metastatic lung cancer. And that was really an eye-opener for me as a GP, thinking about how do we pick up cancers, how do we risk assess, how do we refer, and how do we not miss this serious pathology.
What was your particular research question?
The research question was how this variation, which we talked about in the use of referral, how that might impact on patient mortality, but also importantly, and that never been looked at before, stage at diagnosis. So we might have had something called lead time effect. So you could demonstrate reductions in mortality, but it could be just the fact that you're diagnosing someone earlier rather than necessarily an earlier stage at diagnosis. So stage at diagnosis is key for cancer because it enables you to have definitive curative treatment.
There's big pressure on GPs now not to refer to hospital. Could that be affecting the cancer diagnosis and pickup in patients with early stages of cancer?
Yeah, so this work, as I say, was looking at a cohort of cancer patients for 5 years, 2011 to 2015. Obviously, we had updated NICE guidelines, which came out in 2015, which lower the threshold to refer. So we have seen referrals using this 2-week wait pathway increase by about 10% year on year. So referrals are currently running at over 2 million a year. But that has shown an impact on reducing the number of patients diagnosed after an A&E attendance, who have worse outcomes. And this research really reinforces the view that GPs can use this referral pathway appropriately, and it reduces both the mortality of patients, but also an earlier stage of diagnosis.
Traditionally, GPs have been seen as the gatekeepers to hospital. Is your message that we should be referring more patients?
This is a really interesting question. So when we've looked at international comparisons, countries with strong gatekeeping, that includes the UK and Denmark, maybe don't do so well for cancer outcomes. But we know gatekeeping is cost effective, and it is good overall for the healthcare system. So I think it's a sort of balance there. And I do, for certain cases, maybe we've had maybe too strict historically. And less access to diagnostic testing. If you look at Australia as a comparison, their cancer survival rates are some of the best in the world. We probably need to facilitate access to diagnostics, but that needs investment. We need investments in both GPs and primary care, but also access to diagnostic testing.
If we were to ask you to summarize your research in one sentence.
The take-home message is that GP referrals for suspected cancer are working, and they are reducing patient mortality and enabling patients to be diagnosed at an earlier stage. So really reinforcing what we're doing at the moment, but also the thought process of having access to more diagnostic testing.